Hi, guys, and welcome to a coffee talk, an afternoon chat, a lunchtime sit around, whatever you want to call this. But we are here to talk about the hot topics that we're seeing in all of the dental social media groups. My name is Laura Hatch, and I'm the founder of Front Office Rocks. And I'm here with Christina and Chastity from the Dental MBP. And I will let them introduce themselves in 1 minute, but I just want to talk about what this is that we're doing. Christina and Chastity are hygienists. I'm a dental office manager. We're seeing lots of activity online about how do we do this? How do we do that? What's your office doing? What's my office doing? And so we thought we would kind of come together over some of the hot topics that are being talked about in our groups and just counterpoint, talk about things from everyone's perspective. So if you don't know who I am an office manager, and my perspective typically comes from overall office flow and the front office team. That's who my focus is. And at this point, I'd like to hand it over to the dental MBP, Chastity or Christina. Introduce us and you guys and your perspective, and then we'll kind of get into our subject for the day.
Hello, everyone. My name is Christina. I am the co-owner of the Dental Mind, Body, and Practice with Chastity, and super excited to be here today. This is really a fun topic, right? We had a conversation with Laura recently, and it was, that kind of front office versus back office conversation, and just having a productive conversation about what do things look like. And I'm sure a lot of you are starting to have this conversation. At the Dental Mind, Body, and Practice, we use science to teach people skills to dental professionals. So we really want to look at this from a people skills perspective of how do we take in everyone's differing opinions and different mindsets and different, capabilities and things that we've all learned, and the fact that we also are all going through this time of uncertainty and change, and there's not really like a right or wrong, and how can we help guide you to a place where you feel like, okay, now I feel at least I can have a conversation about what needs to happen. I know what is expected of me from an OSHA standpoint, and then I know what conversations probably need to happen within the practice, and help break that down a little bit.
Awesome. So our topic of today, this is specific around opening back up and the processes of opening back up. And this came up from a training conversation we were having last week about the check-in process for our patients. Coming back from, the quarantine, we now have extra steps for checking on our patients, extra precautions we need to make. And we were talking about, should the hygienist do it? Should the clinical team do it? Should the front office team do it? So Chastity, I guess lead us into the topic today about checking patients in and the steps leading up to where our conversation kind of got to, like, who handles this?
Yeah, so the biggest thing that we can do is practicing for the front office team is really trying to start with elimination. If we look at the ways that we can control any exposure risks, and our front office team is the number one kind of go-to in this, because they're the ones that are reaching out to the patients, whether it is through a phone call, confirmation softwares, emails, letters, all of the above, maybe. I don't know, maybe it might be that busy when you're implementing all of this, but really making sure that we're screening our patients before they ever get to the point of entering into the practice. And those are going to be those CDC screening questions. They're also in the ADA interim guidance for reopening the practices as well. So checking to see if your patient has a fever or a cough, shortness of breath, if they've been exposed to anyone who has been tested as COVID positive, really making sure that we're minimizing that risk. And then also, again, as they get to the practice for that first time, having signs on the outside of the door as well. If they have any of those symptoms, once again, making sure that we're screening for it and having them not enter the practice. And then only at that point are we really going to get to that point where the dental team is starting to physically then interact with the patients.
And you brought up a really good topic. One of the things I teach a lot at Front Office Rocks is the why behind why we're doing this, right? Mm-hmm. And so for a non-clinical person in the front, I feel sometimes it's just one more thing we have to do, one more screening process. And I recently have had to go to the doctor, and I know that we've been out there in the world where at the doctor's office, I got asked 5 different times the same set of questions. And by the 5th person, I could tell she was like, oh my gosh, I've asked this 100 times today. And so I can see it becoming rote for our team, but understanding the purpose of why. So it's really to eliminate or to alleviate as much risk as possible. So I really think that's great that you reminded us why we're doing this.
Yeah, exactly. So the biggest exposure is because this is aerosol transmitted is going to be like the coughing, the sneezing, the talking with one another, anything that's putting us at risk for that. So it seems really just time consuming and monotonous, but it's a huge factor in making sure that we're staying safe before we ever have to get to that consideration of, well, who's taking the temperature or are we wearing masks? That's really our first line of defense.
Awesome. And so we both agree, we on the same page with this, that using technology, if you have it, using your text message reminders and asking the questions and then documenting the information you find from your patients is key during this process, right?
Yeah, so you definitely want to make sure that you're documenting that in the chart, whether it's just right into the chart notes, what the responses to the questions were, if any of them were positive, if you had to cancel or reschedule, just for being able to reference back to that later on if you're reappointing the patients and needing to follow up. But definitely documenting in the chart. Documenting is always big.
Yeah, exactly. On everything we say. Okay. So we've done the pre-appointment, but now they're sitting in the parking lot. And some of us had some of this prior to closing down where we were greeting patients from the parking lot. But Christina, can you walk us through, as of right now, what the guidelines are? And I know it's dependent on state. So can you talk about that?
Yeah, so it's going to be state by state as far as, let's think of social distancing and public spaces right now regarding your state. What are the current recommendations for that? So I know in the state of Vermont, we still need to have social distancing, no more than 10 people gathered at a time, and you need to wear a mask when you're in public. So our expectation for our patients is that we will be asking them to wear a mask when they come into the practice because it is a public space, and then they'll remove that when they get into the operatory. But that is going to be the protocol. And so if they don't have one, we'll provide one for them. So depending on your state, you want to continue to follow those state-by-state guidelines and treat your practice as a public space, not as just like a separate entity. So whatever is recommended in public is what people will be, used to hearing, but we also want to be really mindful of that. If they haven't been going out into public and they say, come on in, but wear your mask, they might say, well, why do I need to wear a mask if I'm coming into the practice? Shouldn't I be safe? So making sure that you've practiced with your team, what does that conversation look like? Why behind it is always great. So just like you said, why are we asking these questions is super important to know, so that, we're not just like, I don't know why I'm asking this. This is super annoying, but the importance behind it. So this is what we're being asked to do in public. And so everyone's going to wear a mask in our practice, and we're going to ask the same thing of you so that we're all following the same guidelines. If you need to, remove things from your waiting room, if we're going to be having people coming into the practice, that's a different story than if they're staying out in the car. And I know a lot of people are asking, okay, so do we have them stay out in the car, or are they supposed to come in? There's no right or wrong answer for that. That's going to be the practice and your setup and what's going to be the best practice for you. So if you have room and you can, create that social distancing, or your schedule is just flowing perfectly, that you're not even going to have people waiting, you're just going to go, 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 you're going to have a runner, whatever it may be, then you might not need people to wait in the car. So whatever that is, there's no right or wrong, but having just some sort of system where when they get here, we know that they're here, we ask them the questions, and then at the door, we have that questions posted again. So at that point, hopefully nobody is entering the door that thinks that they're symptomatic at all. And then of course, it is expected of us right now to also be taking temperatures on all of our patients. So that is part of the current protocol from OSHA that we do need to be following. And that's in the ADA interim guidelines as well as OSAP guidelines as well. And then we get to, so who takes the temperature is where a lot of this conversation came up, where it's like, so who's supposed to do it? Do we have someone in the back? Do we have our front team member? What's going to happen now that we have this thermometer that nobody knows what to do? Who's supposed to?
And it's funny that, and we'll jump into that, I've been on a couple webinars, yours included, where, and we talked about this, where it's, oh, the front will do this, the front will do it. And I know it makes sense. We're up front, the front door's right there. It's easy for us to do. But I'm thinking from the office manager perspective, we've got to ask all these questions. We got to refill the schedule. We got to tell the patients when to come in from their car or not. So I question you guys to say, okay, well, why does the front team need to do this versus the clinical team? So let's talk a little bit from the hygiene perspective. Why will it be an issue for hygiene to have to come do the temperature? And why would you be leaning towards the front versus the back? And again, there's not one right answer, but this is the discussion that we wanted to have.
Yeah, so even when we look, this will apply to hygiene as well as doctors and assistants. If you are in a room and you're treating a patient, even when they're asymptomatic, because of the aerosol exposure, that becomes something that then contaminates our PPE. So when we look at OSHA regulations, we really don't want what we're wearing to be crossing out into the waiting room. So we want to try to keep ourselves in the operatory where aerosols are present and try to keep within that bubble just to prevent any cross-contamination. So we really want to stay kind of behind that boundary for ease of PPE and disinfection, room turnovers, all of that, because we're all going to be having added tasks to our day, and there's going to be this whole new process that each of us are following. So trying to really keep what we can in the areas that we can and reducing that cross-contamination is the biggest reason for trying to keep us towards the back of the practice.